Today it is with great pleasure and an honor for me to introduce our special guest, Secretary of the Interior Sally Jewell. Let me tell you a little bit about Sally. I just met her, but I already know she's like way cool. She loves to ski. Welcome to the best skiing on the planet. She loves the outdoors. She's from the West, and she has a great desire to provide the opportunity, in particular for our youth, to get connected to the outside. I think it's safe to say that one of her primary goals is to develop and encourage the next generations of stewards for our incredible national resources and our national lands. Please join me. It's a great honor and pleasure to welcome Secretary of the Interior Sally Jewell.
Thank you, Stan, and thanks for cleaning out the air with that lovely rain that we had last night and dumping some new snow in the mountains. And I was telling these gentlemen it's rare to actually get a day off in this job, but I'm going to have a day off. Not only that, a weekend off, and I'm going to be right up there enjoying your great outdoors. So thank you, Utah, for turning out some good weather for me. But I want to tell you a story, and it's a story from my last job, and that's with REI. So in that organization, we think holistically about health. And as Mayor McAdams said to begin with, the great outdoors equate to health. Getting into the outdoors helps fuel a healthy lifestyle for Utahns. I also was concerned at REI about a number of our part-time employees that didn't have access to health care. So before the Affordable Care Act passed by some years, we put in place a two-tiered health plan, one for our employees that worked 20 hours a week or more, and that was a full-time comprehensive health care plan. But for those that worked less than 20 hours a week, we realized that oftentimes they had no access to health care at all, particularly if they were working multiple jobs. So we had what we call a mini-med plan. It capped out at $10,000 a year, but it covered comprehensively everything they needed up to that cap. And if they happened to go over that cap, it would be at negotiated rates. So that would lower their health care bills if they went over the cap. So my story is about going to a store, which I did frequently, and visiting with a young employee, 22 years old, who was on a pair of crutches, which around REI is not completely unusual. Every once in a while. Those of us, well, we all think we're young and invincible, but those that really are young, none of us are invincible, feel that they can do these activities perhaps without any health care coverage and not get hurt. But every once in a while, something happens. So 22 years old, on crutches, and I said, well, I hope you were doing something fun. And he said, well, yeah, I was bouldering and I just landed wrong and I got a compound fracture in my lower leg. I said, oh, I'm really sorry about that. Did you sign up for the part-time health plan? And he said, no, I was waiting until I got enough hours for the full-time plan. Now, this would have cost him less than the price of a large pizza every 2 weeks, subsidized heavily by the company to provide a minimum amount of health care. So he said, no, I didn't. And I said, I'm curious, 3 weeks ago was his injury. I said, have you had any health care bills yet? And he said, yeah. And I said, what do they add up to? And he said, 34. I said, $3,400? He said, $34,000. $34,000. 3 weeks in, still in a cast, on crutches. You know that his medical bills aren't over. He's got to get the cast off, he's got potentially rehab, and he's got no insurance coverage. And even though he would have hit the cap for the REI plan, it would have been a much lower bill because it would have been a negotiated rate, and he might have been able to afford that difference. And I said, what are you going to do? Can your parents help? No, my parents can't help. So here's somebody who will heal from his leg much quicker than he will heal from the damage to his credit report for having to default on payments to medical care providers. And if you're a medical care provider and you've got a young person that's got at least a minimal amount of coverage, you're going to be doing everything you can to help that person get through. When they have no coverage at all, it's much more difficult. So we now have the Affordable Care Act. It prevents that kind of circumstance, that kind of cap that was the only way a company like REI could afford to provide part-time health insurance. And yet we still have people that believe they're young and invincible, and the price that they have to pay is too high compared to the coverage they get. And I have to say that that story comes home to roost on just why that is the wrong assumption, why none of us are invincible and everybody should sign up. And when you look at the images over here in the corner that are playing on that ad campaign, it tells you why Utah is special, and it also tells you why everybody should have health insurance. So I encourage all Utahns to sign up for health care coverage before the March 31st deadline. If you don't sign up by then, you have to wait until the next open enrollment period, which is going to be next fall. And I think there are something like 6 out of 10 people who have no health insurance in this state that are eligible for coverage of less than $100 per month. So there are subsidies available for many, many Utahns. And nearly 30,000 of your fellow citizens here in Utah have already selected a health insurance plan under this program. Nearly 30% of them are in this invincible age between 18 and 34. So lots of people have stepped up to do this, and I hope that those who aren't covered will step up and do it as well, no matter how old they are or how invincible they feel they are. None of us are invincible, and this is a great deal. So March 31st is the deadline. They're taking enrollments right downstairs right now, and if we work together, we can make sure that all health care coverage comes down and the health of our citizens goes up so people can enjoy the great outdoors here in Utah and take full advantage of everything you have to offer. You know, no matter what side of the political aisle you're on, I know one thing that Utahns care about are the health and well-being of their fellow people. Not having health insurance drives up everybody's health care costs. It means that people don't get care when they need it, and when they do get care, oftentimes it's the most expensive care through an emergency room. So if people sign up for this health care coverage, and if the governor, in his wisdom, encourages the legislature to support Utah taking advantage of the programs that are available in the federal government, what you will see is healthier Utahns that will bring the cost of health care down because they're getting it at the time they need it, and they're getting it in a more appropriate way. And I know from meeting with Governor Herbert on a number of occasions that he cares deeply about the people of Utah and their health, and I wish him well in making the case for why this program is helpful for everybody in Utah and why Utah should take full advantage of what is being offered.